Welcome.
We are joined by Geratana. I've always liked that. I love that last name.
I know, it's pretty.
Geratana.
Good morning, Mr. Hogg.
Senator Rivera, I just want to make sure you've got the phone numbers to call in.
And let me see. I do. Hold on one second.
Okay.
Well, once I log in, as I will explain shortly to folks, I'm going to have to make a transition from this stable laptop to this bad boy. And when I log in, I'm actually going to do it right now. Because if I log in via Zoom and then it goes. And I dial in. So it actually happens automatically. It gives you a dial-in number, so I will be able to dial in, and I will do that before I step.
Okay, perfect.
All my devices have different times on them, so. Oh, it's not quite 8:30, so we can wait. How has retirement been so far, Terry?
It's been great.
You look so happy.
Yeah, it is. It's really nice to, enjoy the grandkids and, pick up and go wherever you want to go when you want to do it.
That's great. Well,
What I've learned from my friends who retire is that they are no longer required to be in a certain place from 9 to 5.
Right.
But I have a sense that Terry's going to be one of those folks that's probably doing a lot more now, even though she's spending a lot more time with her family, grandkids, etc. There's still a lot of stuff that you're going to get dragged into, I am certain.
Oh, yeah. I've already been asked to do this and to do that.
I knew it.
Oh, yeah. I could do a little bit, but I really, really like it.
Being able to sleep in.
I don't really sleep in all that much. I guess I'm still used to, getting up on the earlier side, but I like those mornings before the rest of the day kicks in. That's
Unlike the one that's like, so basically the one that I'm having this morning, you no longer have. Because I have to wake up early to do a couple of things and make sure that I'm all organized before we start this. Then as we make the transitions, as I will explain to folks shortly, I will then have to get into a staffer's car while doing it on this because I have to go to an all-day retreat meeting type situation. So, and you will be sipping your tea or your coffee, very
Yes.
calmly thinking about the events of the day.
At home. Really nice.
Thanks.
It's good to see everyone. It's good to be, and I'm so grateful and thankful to be invited to this meeting. Thanks, Shirley, and thanks, Gustavo, for thinking of me.
Well, we're so glad to see you.
Well, cool.
You're welcome. You're welcome anytime.
Well, thank you.
All right, I have 8:32, so
Okay.
we should get started in the interest of time, Senator
Well,
Rivera.
good morning to everyone. My name is Gustavo Rivera, State Senator for the 33rd District in the Northwest Bronx, Chair of the Health Committee here in New York State, and incoming Chair of the East Health Policy Committee. And we have our immediate past chair, who we're going to talk about in a couple of minutes. But welcome to everybody. I don't think that I've met, outside of Shirley and Terry, not sure that I've met the rest of you, but I'm certainly looking forward to meeting you in person at some point in the maybe near future. Who knows what's going to happen, but at least we are still living in Zoom times. So a couple of maintenance things. Obviously, this is it is a meeting So there will be discussions happening. If you could make sure to mute yourself when you're not speaking, that would be great. Make sure to unmute yourself when you are speaking, because if not, you're going to get that the ever so famous "you're on mute," which we have become very accustomed to in the last couple of months. Also, and you can put comments in the chat or raise your hand. And a logistical issue. So I have, as you probably know, some of you might know, there's some interesting things happening in New York with ever-changing politics, kind of on a minute-to-minute basis. So I have, after I do kind of an introduction, I'm going to then transition to a cell phone, and then I will get into my staffer's car to be driven like to an all-day retreat because there's again some things that are happening in New York that kind of require our attention. But I will be on. You'll be seeing me now, but you'll be hearing my voice for the rest of the meeting. And so I wanted to, there's a couple of news, just generally speaking. There is this committee will actually talk about a couple of things that we're hoping to discuss and kind of, be able to expand on in the next year. We have including focus particularly on workforce development and interstate collaboration. So we're certainly going to have some conversations about that. We're going to talk about some of the things that we have been able to achieve in our particular states, things that we're working on, and hopefully that can lead to some conversations about things that we can do in between states. And hopefully, as we move towards the annual meetings, there's one in New Hampshire in 2022 and Rhode Island in 2023. Hopefully, we can actually be able to meet in person. Now, I will pass it in a second to all of you, so we can kind of get some general introductions, so everyone they can talk about the state that they're in and how long they've been serving, et cetera, et cetera. Really quickly, just I hope that everyone is vaccinated across the country. It's particularly on folks that do this type of work. I'm sure that you are all aware of the very important need for all of us to get vaccinated. I am House Moderna myself. Hopefully, regardless of what house you belong to, you have been vaccinated. And we can potentially even talk about some of the challenges that we've been facing in different states and making sure that we can reach that percentage of vaccinated folks that will give us some sort of herd immunity protection, because we are seeing that we have not been able to achieve it across the states. Anyway, I will then pass it off to, let me see. I'm just going to read some of the names coming down here, and then we're going to have those folks introduce themselves. Let's see. Obviously, you have Jack from CSG East. Why don't you introduce yourself really quickly, even though you're part of the staff? Tell us a little bit. Where are you at?
This is Allison. Jack just stepped away. I'm afraid he just sent me a note saying he stepped away, but Jack runs our territorial relations committee and helps me do the annual meetings. And that's what I do primarily.
Pleasure to meet you, ma'am, and pleasure to meet you, Jack, even though you're not here. Then we have Michael Hogg.
I'm Michael Hogue. I'm with the Mercatus Center at George Mason University. I think we're fairly new to CSG, but Mercatus is a university-based research center. We do all types of public policy research, a lot in the healthcare space as well, from occupational licensing to regulatory reform, all sorts of things. Some of you may see my emails on a semi-frequent basis, but happy to be here and looking forward to the discussion.
Thank you, Mr. Hogg, and Ms. Gerard or Ms. Braver. If you could actually, that's a good request from Ms. Goldman. We could take down the agenda so we can see each other a little bit better during at least this introduction period. Thank you so much. And again, thank you, Ms. Goldman. So I'll actually pass it to you.
Thank you. My name's Leslie Goldman. I am a first-term rep from Vermont. So I spent my first year on Zoom. It was quite challenging. Still actually haven't been in the State House. So I don't even know where my seat is. So it's pretty challenging. I do serve on the healthcare committee. Our house is predominantly Democrat. We're trying to move forward, but we haven't had much action because we've been so focused on getting through the pandemic. So we've been distributing money as a house, but not going through with any real legislation through the healthcare committee this year.
Gotcha. That's got to, there was some challenge enough to some of my colleagues, because I have a bunch of colleagues that came in last year. But at least we actually came into the chamber for a couple of weeks at the beginning of last year, and then we just went to all virtual. But I can't even imagine. You don't even know where your chair is, really.
No. Yeah.
Well, I'm hoping that you get to find it soon, madam.
Thank you. We did have amusements when we couldn't say, we don't even know how tall you are. And then, it was kind of.
With Zoom, I've forgotten how tall people are anyway. Like, I mean, people, it's like, I forgot that you were, I don't know how to say it, but people are a little shorter in person. How about Representative Elizabeth Burrows?
Hi, thank you. I also am a first-term legislator from Vermont. I serve on the healthcare committee with Leslie, and I also obviously was remote for my first session, or our first session. And I think Leslie probably said it all already.
Let's just assume then that you're both sitting next to each other. So just your chairs are next to each other. So just remember that, and hopefully you'll be able to find them in person soon. Anything else you want to share with us?
No, not at this time.
Gotcha.
I'm really curious about how to get together states on to build capacity, how to get states together on various initiatives.
And we will be talking about that. There will be a roundtable discussion in committee priorities. So we'll be talking about that a little bit later. So yes, hold
Good.
that thought, madam.
Thank you.
How about, and I'm hoping that I'm pronouncing this correctly, Sylvain Levesque.
Hi, everyone. Very good. Very good. My name is Sylvain Lévesque from National Assembly of Quebec. I'm very proud to be with you today. Like another person said, that's the first meeting. I'm the annual Eastern Regional Conference with you. I'm very proud to be there. And I'm a co-whip the government of Quebec. It's my second term as a member of National Assembly. And I'm very proud to be with you to learn how it works with folks from other states. And I'm wishing to be with you very soon for a real meeting. I'm a little bit boring to be in front of the computer, but it's the case this year. And yes, I'm vaccinated those 2 times this year.
Gotcha. It's a pleasure to meet you, Monsieur Levesque. That's as much as you're going to get from me. It just sounds, I just figured I have very little knowledge of French. I just assume that you have to have attitude and phlegm. That's all you're going to get from me. So it's a pleasure to meet you, sir. And hopefully we can meet in person soon.
I'm able to talk to you in English, French, and if it works, Spanish is not so bad too.
Me defiendo, papi. Podemos hablar en eso. En eso sí, definitivamente nos podemos hablar. But I'm not going to continue to do the rest of the meeting in Spanish because then it will be a whole thing.
I do. My wife is Cuban.
Oh, excellent.
Yeah.
Well, again, Monsieur Levesque, is a pleasure to meet you. Last but not least, we have Jocelyn Peña Melnik.
Putting my earrings as we have Zoom, so I apologize. Good morning, everyone. I am actually a Maryland State delegate. I serve in the House. This is my 15th year. I'm the vice chair of the Health Committee for the House, and I am the chair of the Public Health Minority Disparities Committee. So we have been quite busy during COVID, and a lot of the legislation that I have sponsored and has passed deal with health disparities and implicit bias training and so forth. So I wanted to be here just because it is the health committee. I may not stay the whole time because I have another meeting to attend, but I wanted to be supportive, and it's nice. Un gusto verte, Gustavo.
Un placer, señorita.
Igualmente.
But now we've established that there's 3 of us that can make the meeting in Spanish, but probably not the rest of the folks. Maybe. So wanted to do one quick thing before we get.
Excuse me, Gustavo.
There's somebody else?
Senator Rivera, we have a couple of other people. We have Christopher Arnold. David Bayet has joined us. And
why are they not on my screen here? Okay, but you're seeing them, so
I'm
call
tracking.
out the name again.
Christopher Arnold.
I think he left.
Oh, okay. Maybe he was in the wrong meeting. And David Bayet has joined us.
David Bayet.
Introduce yourself, David.
Yeah, I'm watching David Biet. I'm director of CSG East. I'm actually doing both panels right now. I've got ag going on in the background and this on another computer. So I'm switching back and forth. But glad to see everybody. Really nice to see Terry.
Hi, David.
And I look forward to getting part of this at least. So enjoy the session.
Okay, thank you.
Multitasking indeed. All right. So before we get into the actual to the business at hand, and I will do this on here physically before I transition into the discussion in which you will hear my voice but not see my face. As I said earlier, we are joined, as we said earlier, and some of you folks might have joined us after we recognized her, but I wanted to make sure that we recognize our immediate past president, Terry Garatana, which is a great freaking last name. Wanted to recognize her. She has been she retired. Retirement, as we said earlier, just means that she is not required to be anywhere from 9 to 5. She will probably do a lot of things during her retirement, but in her career in public service, which has been extensive and excellent. Not only did she serve as commissioner of state election enforcement, she also served the ethics commissioner for New Britain, Connecticut, and served both in the House and in the Senate, in the Assembly, I should say, in the Assembly in Connecticut, as well as the Senate. And when she was in the Assembly, I wanted to ask you about the Husky Children's Healthcare Bill.
Yeah.
You were instrumental in. You want to tell us about that for 1 second so we can see?
Oh gosh.
Losing to retirement?
What was that, 30 to 25 years ago, something like that? It was really exciting. We had the state children's health pot of money, if you will, that came down from the feds. I think it was in '97. And it was very exciting to be at that time co-chair of the Human Services Committee, and the bill originated in my committee, and it of course made its way through the General Assembly and became law. But it was very, very exciting to be able to do the CHIP quote unquote legislation. And then it became Husky because we have, of course, the Yukon Huskies, if you're not familiar with our sports teams, particularly in basketball. That's an icon, if you will, of the state of Connecticut. So the Husky program, of course, is part of Medicaid, and it's been chugging along ever since. So it was just a very exciting times. And I got to put into the bill, some nice enhancements too for our kids.
So that's the type of thing that we're going to be missing, because then obviously she still served in that was what she was in the House. She served in the Senate. She was then is one of those moments when one of them was like they pulled you back in just when you thought you were out.
Yeah, they did.
Back in, and you were engaged by the executive to have a role in the executive, and now you're stepping down from that role. And as you're stepping down from that role in the executive, you're also stepping down as the chair of this committee. So we just wanted to recognize your efforts, certainly in Connecticut for as long as you have been there, and as part of this committee. And we just wanted to kind of give you a little bit of a virtual clap as well as an actual one, and hoping that as I'm sure you will be, as you will have plenty of time in your retirement, you will be, and we will make sure to invite you to future meetings, and hopefully we can come in and teach us just a little bit about some of the work that you've done. So
Thank you so much. Thank you so
Absolutely.
much, Senator Rivera. It's been an absolute joy and a privilege, certainly.
Well, thank you so much, madam. You can obviously stay with us, but I'm sure that you have some, if you have some tea drinking to go to, or thinking about how much you love your grandkids while you're sipping that tea.
I'll stay for a little while, but you're right. I do have grandchild duties coming up.
whenever you need to roll, you certainly can.
Thank you.
I will be turning off my camera, but my voice will continue to be heard. And I want to transition. And as I do that, I turn off my camera. I still wanted to, there's a couple of things that I want to say. So next thing we're going to have is having kind of a conversation about things that have happened in our states and things that we have been working on. And I'll just briefly kick it off, and then Shirley will kind of be calling on folks so you can talk about some of the stuff that you've done in your states. Obviously, the main policy concerns, certainly many of us have, are the continuing challenges that we have from COVID. Obviously, not only some of the issues directly related to some of the public health challenges of transitioning back into school, all the conversations that have about whether there's mandates of masks in public spaces or certain things. And I know that we have been dealing with that. Most of that has been dealt with at the executive in most states. The legislature has been somewhat involved, but that is kind of something that's more left to the executive. And for me this year, there were certainly conversations about telehealth and all the changes that occurred in healthcare delivery that were necessitated by the pandemic. And then some of the conversations that have happened about making some of these changes permanent in how exactly we organize our, how we pay for and provide healthcare services, and the flexibility that we give to providers to be able to provide some stuff through telehealth, and whether some of those things are going to be continued to be permanent. Also, one thing that has been very challenging here in New York, and I know across the country, has been the impact that the pandemic has had on overdoses. There's some work that I've done in the last couple of years on harm reduction, and have been continuing to do it this year, but including one bill that I'm incredibly proud of related to an opioid settlement fund that we were leading in New York to make sure that this money that we get from opioid settlements goes to treatment and the recovery and harm reduction. And certainly, last but certainly not least, and this is very much in line with Vice Chair Peña's interests, the way that the pandemic has taken healthcare disparities, which were already kind of baked into the system, and made them even worse. And so those are some of the general things that I have been that I have been dealing with legislatively, but certainly want to get a sense as I do this transition. My voice will sound different because I will switch from my microphone on my computer to the one on my phone shortly, but want to hear from folks about what are some of the things that they're doing in their state, some of the challenges that they're facing in their state. And I'll pass it over to Shirley so that she can read off some of the names and people might want to participate. Yeah.
Thank you. Thank you, Senator. Have a good transition. We'll keep you in your ears, and we'll keep ourselves in your ears anyway. We'd like to hear from anyone, and you can just, we're a small enough group, you can just unmute yourself and go ahead and share some thoughts that you have about what's been going on in your state, what the issues are. And we definitely want to leave today having a sense of priorities for this committee, the kind of things that we can do in our blogs and and if there are meetings that you want to have, webinars, information sharing, workshops, to please be sure to let us know so Senator Rivera and I can begin to shape the next year in terms of what we can do best to serve all of our states. You will be pleased to know that there is a committee that's going to be formed to focus on workforce development and interstate collaboration. So I know that that was raised already, but we need to be sure that we keep that and the issues in relating to health and public health with that as well. So anyone ready to start?
I can start if you like.
Thank you.
So in Maryland, what we learned, we have a little over 6 million people, and we have 24 counties, including Baltimore City. What we learned with COVID, when the data began to come in, is that the number of COVID cases in the Black and Brown community were a lot higher than other jurisdictions. So the one county that has the majority African-American county, Prince George's County, out of the 24 jurisdictions, had the highest number of COVID-19 cases. And then the SIPCO in the entire state of Maryland with the highest number of COVID-19 cases, and which is probably pretty similar everywhere else, is 20783, which is the immigrant Latino community.
Mhm.
So we started to focus a lot of the resources and outreach in those communities. So I actually introduced a bill which requires implicit bias training for all healthcare providers in the state of Maryland. And the healthcare providers that is defined in our code is not just doctors, right? You have nurses and people that work in the hospitals, in the clinics. Last year, I had introduced a bill that require implicit bias training for anyone, any healthcare provider that touch a pregnant woman, because the number of Black women, are dying at a higher rate than white women after they give birth. So this year I decided to expand it. I worked on it for over 7 months with our speaker, who's wonderful, and other colleagues. And I brought to the table all the boards and commissions and MetCai that represents the doctors and the hospitals, the health insurance company, you name it. And we compromised on the language, and we actually, the bill became law. The governor allowed it to come, to become law. Another bill that I put in is one that was a bit controversial, and the Senate stripped the language, but we put it back in the House and it passed. And the governor, believe it or not, we have a majority Democratic legislature and a Republican governor. He allowed it to go into law. Is a bill that declares racism as a public health crisis in the state of Maryland. And we had a lot of different whereases that I was very, very careful in making sure that it was accurate, that goes back to slavery and the history. And the bill creates it's actually a commission in Maryland, and it's a permanent commission where all the different secretaries and all the departments, the Department of Health, Agriculture, Education, you name it, the environment, must come together and meet 4 times a year. And they must create and design a health equity framework, in dealing with the different policies for every department. They must also work with the IT department for the state of Maryland and gather certain data and share the data. I think that it is a good idea to meet, to talk, and to see how the policies we pass affect all of us, all the citizens in the state of Maryland. And that actually, the fiscal note required money for staffing, because a lot of times you pass these commissions and we don't put money for staffing. And that was really important to me, to make sure that we did that. So a lot of the bills that we passed this session, gave money relief for a lot of programs for housing, lawyers, for foreclosures, health, you named it. But my focus was primarily on the health disparity bills. Lastly, the one bill that I put in expands the definition of telemedicine to include audio only. And I brought in all the health insurance companies, the Blues, Kaiser, and we negotiated so that they can reimburse for it as well. And as you know, that was really important in the last year and a half.
Thank you so much. And I should probably, I didn't at the beginning introduce myself. I'm sorry about that. I am Shirley Jordan. I'm the health policy consultant to the Council of State Governments East, and I am a nurse. So I thank you for those things. They are near and dear to my heart personally, professionally, and to the organization. These issues are across the country. I don't think there's any, Terry would know. We have a similar bill for commission declaring racism as a public health issue in Connecticut. That did pass as well.
Shirley, we did pass legislation this year similar to Vice Chair Pena Melnick in Maryland.
Yeah. And the Connecticut Commission sounds quite similar in that it actually, I read it before I sent out my support for it to make sure that it did include some action and not just, a nice declaration. So
right.
That's great. All right, I'm trying to capture the richness of all of this. Next, who would like to?
I was hoping that I could tag team with Leslie on what we've been doing in Vermont. We've done a lot of similar initiatives. We looked at audio only telemedicine. We wanted to make sure that it was being billed at the same rate. Excuse me, I'm outside, I'm on my porch and my ducks are really acting up. So if you hear them in the background, I apologize. For telemedicine, we wanted to make sure that providers were reimbursed at the same rate as in-office visits. We passed a health equity bill, which included, which is basically a disparities bill, and we interviewed, or we took testimony from a number of underserved community members, and we set it up so that they will be the ones who are driving where we go. We will have a task force composed of exclusively people from underserved communities. And we also, I believe, Leslie, correct me, it also includes more robust data collection. And we also declared racism as a public health crisis. We also passed a bill that covers undocumented pregnant women and children up to 2 years old. And this didn't wind up serving a huge population, but it did serve about 120 women who previously had not been had their pregnancies covered. Let's see.
Can you folks hear me now, by the way?
Yes, we can, Senator
Yep.
Rivera.
Oh, okay, there you go. I'm sorry. I just had a little bit of a transition issue there, but because I just wanted to mention two quick things. First of all, quite impressed with both in Vermont and with Representative Pena Melnick, that you folks are actually kind of ahead of us on both of those things as it relates to healthcare disparities. In the case of New York, there was an executive order that the governor issued on racism as a public health issue, but it being this particular governor in this particular instance, it kind of was overshadowed by some other little things that the person is involved in right now. But also the on the issue of newborns and Medicaid patients, mothers, new mothers, and expanding Medicaid coverage for them. That is something that we have been trying to make sure that we get in the state of New York as well. You were able to achieve that in Vermont?
You're muted, Elizabeth. Representative Burrows.
I'm sorry that I might, Leslie, do you want to take that?
Let me understand the question. Were we able to accomplish this? Yes, we were able to provide, it was called Medicaid-like because we had to fund it independently of the CHIP program for the first year, which was a big win because they wanted to push it out a year, but we kept the pressure on from the healthcare committee. So that was a big win and we got it in starting this fiscal year. And as Elizabeth said, it is about 22 mothers and children who are now covered. We could send you the copy of our bill if that would be helpful.
It would, because I think it definitely sounds like in the case of New York, we were looking to mandate that the health department seek a federal waiver to extend Medicaid coverage for up to a year for both mothers and their children, and actually identify federal money for it. So because there is, I believe that in the rescue package, the last one that was passed, some money was made available for this, so that states can avail themselves of it. So there is, so yes, I would definitely like to see that bill.
Great. Anything else from Vermont?
I'll just say that it's interesting. Our bill is only 4 pages. So it's pretty straightforward. Just for your research purposes, it might be simpler just to say it's H430 in this current session. So it's pretty findable if you go to the State of Vermont legislative website.
H430?
Yeah.
Thank you.
I think Elizabeth did a really good job sort of pointing out what we've done. That we did do a buprenorphine bill to decriminalize small amounts of buprenorphine in a teen population. So that was an important way to address the opioid problem. Telemedicine was a big conflict, as Elizabeth said, but we ended up with a task force, which was a little disappointing. We wanted to go forward looking at parity based on standard of care, because we felt the telemedicine, whether video or phone, was still giving the same standard of care. So we got a year for that, but now there's a task force looking at that. I would like to ask a question, if I may, just to throw it on the table. We're going to be looking at medical debt, and I'm interested in what other places are thinking about medical debt, particularly from the provider point of view. I mean, the consumer point of view is one end of it, and there's a survey that just went out in Vermont trying to get some data regarding medical debt. I'm also interested in thinking about it from the provider point of view, preventing hospital closures, particularly in rural hospitals where medical debt can be overwhelming. I sort of have this question, is it why, sort of as the hospital, from the provider point of view, as the final pathway of sort of our healthcare system and our health, if you think about social determinants of health, end up being the responsible party for people being unable to pay for healthcare. So I'm curious about that question, and would like to think about alternative ways of supporting hospitals and dealing with medical debt.
If I may on that one, so I have a pretty expansive medical debt bill that has been fought tooth and nail by some hospitals here, but most hospitals that are fighting it here are some of the bigger, wealthier hospitals. I want to understand, however, since most of it is about consumer protection, the amount of percentage of interest, and all sorts of other things. What in particular, I want to understand what you mean by as far as medical debt as it relates to providers. Could you break that down for me a little bit further?
Well, I can. I sort of see it as a similar thing as the cigarette agreements that we came to. Tobacco producers were being held responsible for outcomes of illness and had to pay. I think that if we look upstream, I'm just thinking about way upstream about what a lot of the causes of our healthcare problems are: diabetes and heart disease, certainly environmental toxins, et cetera. This is all way upstream. The way our system is set up now, it seems to me that the hospitals end up being responsible for this debt for consumers who can't pay it. And I just don't understand why it's the hospital's responsibility. I haven't seen a lot of conversation about this. And I have to say that I come from I'm a nurse practitioner and 37 years practicing in primary care. So it's a question of who owns the problem. And it seems to me that our culture is not owning the problem. It's a huge part of our GDP and our state domestic problems too. A huge amount of our budgets are going to this now. And it's not making sense to me, just from a sort of an existential point of view, if I may say.
And if I may ask, I don't know, since I'm on the move, I don't know if our Canadian friend is still with us, because I want to see if there's anything that he would not like to add to this particular conversation, because there's a bill that I have in the state of New York because I too have this existential crisis, and I believe that this existential crisis will not be resolved until we make a transition to a single payer system in this country. I have a bill in the state of New York called the New York Health Act, which would do that in the state of New York. So it would be a single payer system just in the state of New York, and with the goal of providing a model for the rest of the country. I don't know if because some of the existential issues that as you refer to them as existential, I agree with you. And I think a lot of it has to do with, we have a for-profit healthcare system, and a lot of it is just can be, traced back to that. I don't know if our Canadian friend is still with us.
No, he is not.
That is unfortunate, but I would say that a lot of these issues are about healthcare costs overall, drug costs, medical debt, etc. All of them have at the core of it the fact that our for-profit one, and if we don't tackle that, we're just going to kind of just be, nipping around the edges, so to speak. At least that's how I see it.
Well, I think they're almost two different questions. I mean, I totally agree with you. I think a single payer, we got to get rid of the complexity. It's ridiculous. So I'm totally with that. But I think in a way, I'm asking a different question, is that whose problem is this? And I feel like our culture has made it the healthcare system's problem, so that we as providers are expected to fix people when in fact the source of the problem is way upstream. And I really would like to see how we can talk about that. And I am a first year legislator, obviously. I may be pretty naive about how we could think about it. But as I say, the social determinants of health, we talk about food wastelands, we talk about environmental toxins, et cetera. I feel like people who are perpetrating the problem should be responsible for paying it, and maybe infusing money into our healthcare system to be able to get to a point where we could have a single payer, or people could be healthier, or, where do we get that infusion from the perpetrators, I guess, is what I'm wondering.
Well, you're not alone.
By the way,
Go ahead, Senator.
a quick point that I wanted to make is that I would argue that new legislation, what they do is they bring a fresh perspective. And since some of us I've been in the legislature for 11 years, which means that sometimes I need someone who is newer to a legislature to be able to break me from some patterns that I've been kind of locked into. So I certainly would not call any of the concerns that you have naive. I would just say it kind of forces some of us who have been around for a little bit longer to kind of say, like, have I considered that before? Have we thought about it before? Or is I just have to think about it differently? So I appreciate that. Do not, you are not naive, madam. You are just bringing new ideas to the mix.
Thank you.
Absolutely. These issues have been kicked around quite a bit, and I'm taking a lot of notes because I think we've got some sessions that we can begin to think about to address some of these issues and have some good discussion about what to do. And I think the idea of regions collaborating is really a powerful one. Others, we didn't get Ms. Fenton Fung to introduce herself, I don't think. Can you unmute and maybe she's not there at the moment. Oh, she's having audio problems. Could you put tell us about yourself in the chat? So oh, great. Can everybody see that? Representative Fenton Fung, and where are you from, Representative? She's a new representative as well and a trauma physical therapist from Rhode Island. Wonderful. Great. Is there any burning issue in Rhode Island that you'd like to share with us? Oh, okay. And can everybody see that? The focus there is on the social determinants of health, in particular housing, and looking at and some of those upstream issues that Representative Goldman mentioned. So thank you.
Hi, Shirley, it's Terry. I just
Yes.
want to interject that I recently, one of my good friends from the legislature, Representative Susan Johnson, and I got together socially, and she said that she and some others are looking at a Medicaid waiver that would allow Medicaid dollars to pay for housing. I thought this was very interesting. I don't know whether she put it in the form of legislation, but at least with, thank goodness, the focus on health disparities and social determinants of health, that looking at housing as one of these issues that needs to be addressed. I think it's absolutely fabulous if this comes forth. I just want to mention very quickly, although I'm not with the Office of Health Strategy any longer, they've been working over the last year on Governor Lamont's Executive Order number 5. There are many components, including enhancing primary care and finding ways to do that. Our Office of Health Strategy was charged with the duty, under the executive order, to also look at creating what we call cost growth benchmarks. And these, I'm sorry, I didn't realize I wasn't on video. And these benchmarks are and have been established for this past year, 2020 to 2021, at 3.9%, and have been established now going into 2025. And what this does is there's no, if you will, sticks behind this executive order, except that I think what the plan will be is that as time goes on, to see how hospitals and health systems and others in our state are keeping the cost growth down to this level. Again, there's no, as I said, law, if you will, that says that they have to do this. But I think it's a good way of looking at what healthcare costs would be considered to be reasonable in our state, particularly when it comes to hospitals. So, you know, if anyone is interested, I can post links in the chat, you know, to that. And we also, I just, before leaving OHS, we just finished a Connecticut health affordability index that we had developed, and I can put the link in the chat too to that. I think it would be very interesting for people to see how we've determined what personal health care costs are in the state by family size and by region and so forth. So I'll go ahead and do that, and thank you very much.
That's great. Thank you so much, Terry.
Sure.
Others who want to share any thoughts? Representative Fenton also added to the list issues around the opioid crisis and harm reduction centers. And I know that's near and dear to Senator Rivera's heart as well. So it looks like we've got another important issue to deal with.
Indeed, if in my case, there are two bills that I carry related to, there's all sorts of different names. There's supervised injection facilities, the one that I'm using currently, overdose prevention centers, but there's all sorts of names for them. There's two bills that I carry. One of them that would just outright regulate them and authorize them, and another one which would create a pilot program, which is a much smaller bill. But we have been in the state pushing our executives both at the state level as well as and in some large jurisdictions like the city of New York, to have the executives do them by executive order, and looking very closely at the conversations that happened in Pennsylvania around some of the centers that were open there. And this is, I know that our Canadian friend is no longer with us, but he could also probably educate us about this, since I actually went to visit one of these facilities in Toronto a couple of years ago, before, pre-pandemic. So it was literally decades ago. But in any event, the concern has been, how do we actually, for those folks who might not know, these are facilities in which people would be able to use drugs under medical supervision. It's the continuation of kind of the next step of the harm reduction model, which assumes no judgment on a person who uses drugs, treats drug use and addiction as a public health matter, not a criminal justice one, and just basically saves lives. And we're pushing for either a legislative solution or really an executive solution, since I would want, even if it was any executive to take credit for it, having them in places like my district, and I would ask for it to be physically in neighborhoods that I represent, because those are the ones that are struck by high rates of overdose deaths, particularly in the Bronx. So anyway, who is the legislator that actually is looking to do something like that in their state? You said that they were talking about it on the chat.
That was Rhode Island.
Oh, it's already done. I would love to have. I'm sorry that they're having audio issues, because I would actually love to hear about that.
Okay, good. Representative Fenton's going to send the article into the chat so we can look at that. But I think that this is shaping up to be something that we can certainly have a interactive webinar on, and have some of these things presented and discuss opportunities with other states. That's great. Okay. So it's an AMA report. Okay. I'm writing all this down as well. Great. Others that we haven't heard from who would like to weigh in? Mr. Hogg?
I'll just, can you hear me?
You're a little faint.
Now.
That's better.
Okay. I'll just give a little bit of an update on what research that we are doing right now. So in the last legislative session, we've testified in a variety of states, our scholars have, on direct primary care and also on the telehealth issue, looking at the benefits of telehealth and all of that, all of the issues encompassing telehealth. We also have a new policy brief that just came out this month on healthcare to the home and looking at the benefits and the possibilities of getting healthcare directly to the home rather than using the traditional services.
Is that, excuse me, is that for all age groups or is it targeted on particular age groups?
Nope, all age groups. Yep. So I mean,
yeah, some states have done some home visiting for families, childbearing families, for mothers and children, and others have done some work, which we'll actually be talking about at a session during the annual meeting this week about older adults, healthcare for older adults. Sorry, go ahead.
No, right, absolutely. So yeah, we've also been doing. We've been looking at scope of practice reform and testifying in a few states on the scope of practice expansions and then licensure, occupational licensure as well. So we have our hands in a little bit of everything. But yeah, thanks.
Mr. Hogg, could you on the scope of practice that was very general. Anything in particular related to scope of practice that you folks are doing research on?
I can get that to you off the top of my head. I'm not exactly sure what the most recent issue, the most recent studies that we've done are, but I will follow up with you on that.
Thank you.
And on that note, Senator Rivera, what happened to your bill on nurse practitioner scope of practice?
There is. Let me see if I can remember. I'm not sure if I am carrying a bill on scope of practice for nurse practitioners. There was a. I have to. One of the things that happens when I've been the chair of the health committee for the last couple of years, for 3 years at this point, and this is my 3rd year, and there's so many friggin' bills, some of which pass, some of which get vetoed, right? And which I don't remember exactly the one that you're referring to. There's a couple of other ones that are kind of top of mind because they were just signed, or I'm fighting with the governor to sign them, or I'm shaping them up for next year, and that is not one of them. So I am sorry to say that I don't remember the exact bill you're referring to.
And Francis Gelinas has just joined us. Would you introduce yourself? Thank you.
Sorry about this. I had a hard time getting connected. I live in Northern Ontario, and Wi-Fi is not always what you would like. I'm Francis Gelina. I'm the MPP for the riding of Nickel Belt, which is in Northeastern Ontario, and pleased to meet you all.
Thank you for joining us. Representative Burrows has her hand up. Go ahead, Representative.
I apologize for not having my video on, but I apparently have an unstable connection. I forgot to add that we spent quite a bit of time on issues of mental health and how to treat a really rapidly rising problem in a rural state, and along with a dearth of providers. So it's still a really tough nut to crack, actually. But we spent quite a bit of time on the length of stays for children seeking healthcare or mental health services, the lengths of stays in emergency rooms, which was up to like 2 or 3 weeks.
Oh,
We have it down now, but it was really very, very troubling in the beginning. We couldn't legislate our way out of it, but anyway, mental health care is rolled into healthcare in our legislature, and it certainly has a strong role in our consideration.
Is there anyone else we haven't heard from? Mr. McLaughlin. Okay, we've lost a couple of people. Terry wishes us all fond thoughts. She has gone off to be a grandparent. So thank you. Well, we have about 12 minutes left if one of my clocks around me is correct. I have a list of probably about maybe 15 topics that emerged from the issues that were raised today. And maybe it would be helpful to just sort of identify what people would regard as their priority issues. We can probably do this in another way. Representative Goldman, is your hand up new or is that from previous?
I just wanted to add, someone mentioned Nurse Compact, and Vermont just signed into the Regional Nurse Compact. So just wanted to get that on the table because the workforce issues are huge. Elizabeth just mentioned that in the mental health field, but also nursing, and adds, of course, to traveling and the great costs. So Vermont did pass that this year.
Great, congratulations. So would this group wish to give Senator Rivera and I any guidance and where we might start to begin to tackle some of these issues? Identifying what may be the most important one on your plates, the most troubling, the one you think is a low-hanging fruit that would be easy to address?
Leslie and I have, or Representative Goldman and I have been talking quite a bit about how to approach this next session. And I feel frustrated that the answer to everything is universal health care or single payer, because everything else, every other issue we bring up is dwarfed by that idea. And so this is also more of an existential question, but how to grab onto an idea without feeling like we're nibbling around the edges, because we're not really nibbling around the edges, because if we don't hold it up to single payer, then it has its own validity. Does that make sense?
And I don't know if you can all see the notice from Representative Fenton Fung about single payer issues. So maybe one of the things we need to talk about are alternative strategies to address. There's sort of two big areas. One, as has been pointed out, is the upstream issues, addressing the upstream issues. And how do you do that in a global way? And then the other that is sort of coupled with that, and we're constantly grappling with, the costs, and they're certainly related one to another, the costs of healthcare in a general sense, both to individuals and to the communities. So those are sort of two broad pieces of the same coin. Representative Goldman, go ahead.
I would just want to understand what you've said in a regional context. Vermont's a very small state. There's not a lot that I think we could do in a sort of fundamental way on our own. So I'm wondering if there are other ways of joining together to look at some of these problems more universally if possible.
That's great. And I'm a former New Hampshire rep, and I worked at Dartmouth Hitchcock as a nurse. And so I certainly know that there are two states that as different as they may be at times politically, certainly share a lot of issues together around healthcare. A lot of our patient population at Dartmouth came from Vermont, all along the border. So those certainly raise some interesting issues. So maybe a session focus on what have states done collaboratively to address healthcare issues. And use that as an opportunity to explore other ideas as to what might be done. Because there have been some states that have gotten together to address healthcare costs in ways of certainly the compacts that have been done for licensure is one thing that has states have done together. And there are some other issues around COVID. Some states have worked together. Massachusetts, Vermont, Massachusetts, Connecticut, and New York have worked closely together at various times throughout the last year. So that's certainly another good opportunity. So.
And I'll end, I know I'm saying a lot here, sorry. There's a contrast between, you bring up Dartmouth, which of course is an enormous tertiary care center, in contrast to our small rural hospitals. And sort of that notion of how they contrast, and should they be expected to jump through the same hoops, which really isn't necessarily fair or good for the small rural hospitals.
Yeah, that's another great issue, and we could partner with some of our colleagues on other committees around that issue of collaborating and how do you build the networks without the takeover as we've seen. Small rural hospitals, survival, I'll just call that survival and integration. And most of our states do have a significant issue with rural hospitals. New York has, Connecticut has some small hospitals that are rural, not since it's small, it's pretty easy to get to places, but they are important centers for healthcare in their communities. So certainly something to look at. Other issues, we have just a few more minutes left.
Their healthcare disparities came up more than a few times, and certainly, as I mentioned, I think that the folks who have spoken here are kind of ahead of the curve, certainly of me, which I'm thankful that somebody is. So maybe having conversations about more broadly injecting healthcare disparity conversations into all the different states' policy conversations.
Great. And one thing I did want to be sure to mention is that those of you who are on the call who are not necessarily been appointed by your states yet as official representatives, I will put you on a mailing list of people. So we'll keep you informed of things that the Health Committee is doing in case you don't see the website. But I encourage you to look at the CSG East website, because that will keep you up to date on what's happening, and other committees often touch on things that are of interest. So I will be sure to include you on whatever communications that Senator Rivera and I do on behalf of the committee and CSG East. Okay, Senator, do you want to have some closing remarks and ask for any input from our participants?
Well, I think, first of all, I thank everyone for hanging out, the folks that did, and definitely a lot of great potential topics here. And mostly today it was just about this kind of brainstorming about different things that we are thinking about legislatively, that we're tackling, that we just have tackled, and thinking about how we could have these be topics for discussion for the entire committee for the next year. So certainly I would encourage you to continue to participate. I'll be touching base with Shirley in the next couple of weeks to kind of take all these ideas and see what we could come up with. There's certainly a lot there. And I would just underline something I said earlier, particularly for the newer legislators. It is those sometimes you have those ideas are ones that we might have had, that folks like myself who've been around for a bit had a while back and then kind of just pushed to the side because of the grind of the day to day. So thankful for folks who kind of just say, no, wait a minute, this is what I'm thinking about right now. I just got here and this is how I'm thinking about this. That is all of that brought to the table makes every one of us better. So I thank the new legislators for having that energy and keeping that energy. Hopefully, as you go into your actual legislative chamber and actually figure out where you're sitting and such, hopefully that happens soon. But besides that, just wanted to thank you all for participating, and hopefully we'll be meeting in person at some point soon.
There are several other sessions related to healthcare going on tomorrow and Wednesday and Thursday. There's one on age-friendly communities. There's one on public health that may be of interest. And and the other one is talking about, and particularly some of our new legislators, but I guess everyone might be interested. There is a session on managing the stress of your work in the public sector. So please join us at those sessions if you are free. So I add my thanks to Senator Rivera, and we will be in touch with you soon. Thanks so much.
Thank you
Have a
very much.
Great day. Thank you.
Have a good one, folks.